as a long-term or short-term care program for drug abuse. Treatment centers are used to encourage the stoppage of drug abuse through their various programs. Drug abuse treatment centers offer a wide variety of ways to help attain a clean lifestyle for many addicts that are struggling with their addictions. Many drug abuse treatment centers are staffed by recovered addicts or alcoholics. Since drug abuse is common, treatment centers use rules and stipulations to keep things alive and well in their institutions. There are many institutions and organizations that help drug abusers kick the habit. The support of friends and family is of prime importance. First and foremost, an abuser must be committed to giving up drugs. Doctors and counselors are a drug abuser's greatest ally in the battle against addiction. People who realize they have to quit this dangerous habit may be too embarrassed or afraid to confide in anyone. They might even be worried that they will land into trouble if they admit to having this problem. Abusers must talk to anyone they trust. What happens when drug abusers experience things they don't want to? Here's the problem. Drugs dull perceptions. Drugs are essentially painkillers. Drugs kill mental, emotional and/or physical pain. That means something that is distressing a person can appear to reduce. The stress seems to go away a bit by the drugs, dulling or hiding the experience from the person. They can't see or experience the discomfort as readily. Sometimes these discomforts come from the past. Remember, the mind is made up of past experiences or memory pictures. Drug abusers have been solving their problems by dulling out their abilities to see these problems. At times the problems right in front of them are unseen by a drug abuser. Other times issues from their past are blocked out. Let's take a look at one way drug abusers dull their perception of the past with drugs and with other mental tricks. Drug abuse, including marijuana abuse, pharmaceutical abuse and alcohol abuse, have one thing in common: justification. As a drug rehab consultant, I hear more justification for drug abuse and use than most. Here are some rather common and even infamous justifications I've heard over the years. Mental justifications. They don't understand. I just need one more hit, then it'll be okay. What's the big deal? It's just one time. This will fix things, and I'll make it through for a while longer. Generally, patients take medicines as prescribed by their doctors. When taken this way, there is very little chance of the patient getting addicted. According to the National Institute on Drug Abuse (NIDA), millions of people today use medications for non-medical purposes. People try to justify drug abuse by convincing themselves that an overdose of prescription drugs is not as bad as street drugs, such as heroin or ecstasy. The truth is that any kind of abuse is unwarranted. The problem with prescription drug abuse is that it starts with the consumption of a few extra pills for quick relief. The patient does not realize that abuse or addiction is likely. College students seem to do very well with social/educational methods of rehab, as they aren't expected to admit they are powerless over their addiction. In fact, the opposite is true. Social/education rehab models consider a drug abuser is completely responsible for their drug abuse, but their lives are simply out of control.